السلام عليكم ورحمة الله. بسم الله الرحمن الرحيم. We'll go through the arthropod-transmitted cestodes, which are those with the larval stages present in arthropod vectors. These are intestinal cestodes present in man and animals also, and we'll have to begin with Hymenolipus nana. This is the most common of them, and also it is a human infection rather than animal infection. It is called the dwarf tapeworm because it is very short and tiny. Firstly discovered in Egypt by a German doctor in Egypt. Its disease is called Hymenolipus nana infection or hymenolipsiasis. The definitive host is man and rodents. The rat flea and grain beetles اللي هي يعني السوس اللي موجود في الحبوب أو موجود في الدقيق ممكن ينقل الانفكشن as intermediate host having the larval stage of Hymenolipus nana and the next worms also. Man can also act as intermediate host as well as rodents because the larval stage can inhabit the small intestine of man and the cycle goes on without need of any intermediate host. Distribution is cosmopolitan. This is the life cycle of Hymenolipus nana. Here it is present in the small intestine. The eggs come out because the adult worm has also immature, mature, and gravid segments. These gravid segments disintegrate to give the eggs which pass with stools. When man swallows the egg or the insect swallows the egg, they can give rise to the larval stage, which is the cysticercoid developing in the intestinal villi of man and in the body cavity of the insect. When the insect is swallowed by a rat or mouse or by human being accidentally, the infection comes again to man. The cycle, as we said before, is present in man without need of the intermediate host because in man, if man swallows the egg, the oncosphere comes out, penetrates the villi of intestine, and the cysticercoid develops there. When it is mature enough, it goes out, forming the scolex of the adult worm, which gives rise to many segments, and the cycle goes on. This is very important because it is an infection of children mainly, but adults also have the infection. When we come to the morphology, it is only a few centimeters, maybe up to 6 centimeters. All the segments are broader than long, as we'll see in the next slide. The eggs are small, about 45 micromillimeter. They only come out in stools with filaments around the second embryophore. These are the filaments coming here. This is a knob, polar knobs around the inner embryophore, and the filaments come out of these knobs. They are about 8 filaments from each pole. Inside there is the hexacanth embryo with these are the hooks present inside. This is the scolex of Hymenopus nana with a small rostellum. This rostellum has a row of tiny hooks inside, and these are two of the four suckers present in the scolex. Here is the mature segments of Hymenopus nana. They are all broader than long, as we see. They are small, telescoped as they seem from the outer side. All the genital pores are at the same side of the worm. Here is about 3 testes and 1 ovary inside each segment. This is also the egg of Hymenopus nana, and this is a common artifact present in stool looking like the egg of Hymenopus, but it lacks the hexacanth embryo. If this is not present, this is an artifact of the egg of Hymenopus. Pathogenesis, the presence of the worm inside, it, it is, if the infection is few worms, it causes also no symptoms. But if the infection is heavy, there is enteritis, there is abdominal discomfort, loss of appetite, colic, and diarrhea sometimes. In this case, the patient may ignore these symptoms because they come and go every few days and the infection continues. If the patient is immunocompromised or has less immunity for any reason, we'll find that the infection is aggravated because many eggs hatch readily in the intestine and penetrate the villi to form the larval stages which come out, and this we call hyperinfection. Hyperinfection is a phenomena that means the patient infects himself readily for several times and the infection becomes heavy without external infection from anywhere. There are also some allergic manifestations due to the tissue faces of the cestode of Hymenopus, like flectins. Flectins, this is an inflammation in the conjunctiva around the limbus, and it is very common with Hymenopus nana infection. Also, there are maybe some neurologic manifestations due to the neurotoxic products of the worms. If the infection is heavy, they tend to cause dizziness, convulsions, and especially in young children. Its diagnosis is easy because there is tremendous egg production, which can be easily seen in stool examination. Treatment must be repeated for intestinal larval stages. This is the case when we take the yomisan or the niclosamide because it is not absorbed from the intestine, so it kills only the adults in the small intestinal lumen, but doesn't affect the larval stages in the villi. But if we take another drug like praziquantel or albendazole. These drugs can kill the larval stages and no need for repeating the drug again after 1 or 2 weeks. Prevention and control is by proper sanitary measures which prevent the eggs from being swallowed by human because they are the main source of infection and not the insects, as I said before. The second worm of the arthropod-transmitted cestodes is Hymenolipis diminuta. This is called the rat tapeworm because it is very common in rats and very few infections happen in humans. The rat tapeworm is called Hymenolipis diminuta. It is also cosmopolitan, the same distribution as Hymenolipis nana. The adult size is about 30 to 60 centimeter because it is very large, up to 90 centimeter long in big rats, compared to Hymenolipis nana, which is about 1 to 3 centimeter long. The scolex doesn't have hooks in the rostellum, instead of Hymenolipis nana having a single crown of hooks. The mature segment is similar to Hymenolipis nana, but the testis and ovary are extended more laterally. And also the genital pores are on one lateral side. Concerning the eggs, also the eggs are bigger than those of Hymenolipis nana in diameter. They don't have hooks, or they don't have polar knobs or filaments. This is very important for differentiation between Hymenolipis nana and Hymenolipis diminuta eggs. Continuing the comparison, the definitive host is mainly man for Hymenolipis nana, while it is mainly rats in Hymenolipis diminuta. Infection is accidental in human because the man must swallow the grain beetles or the involved rat flea for getting the infection. In case of the larval stage, it is the cysticercoid in both. Cysticercoid is only present in the grain beetles or in the rat flea in case of Hymenolipis diminuta, but in Hymenolipis nana, it can be present in the small intestinal villi also. Human infection in case of Hymenolipis nana, repeatedly again, this is very important, is by ingestion of eggs and also ingestion of insects. In case of Hymenolipis diminuta, it is only by ingestion of insects containing the cysticercoid. This is the life cycle of Hymenolipis diminuta. We see here that it's only one life cycle with the eggs coming out, ingested by the arthropod intermediate host, and then the oncosphere comes out. The cysticercoid is present in the body cavity of the insect only. When ingested by rodent or human, it gives rise to a scolex which grows into the other segments. Gravid segments can be seen in case of Hymenolipis diminuta because they are big, they aren't easily disintegrated as those of hymen lepis nana. And the gravid segments have a big sac full of eggs, which is the distended uterus covering all the all the components of the segment inside. This is the egg of Hymenolipis diminuta with no filaments here or knobs as that of Hymenolipis nana. This is also other picture of the eggs. These are the cysticercoids. Here they can be easily found in case of Hymenopus diminuta, but they are present also in Hymenopus nana with the invaginated scolex here, and this is a tail-like extension, so they are called cercocystic cysticercoid. These are the mature segments of Hymenopus diminuta. Pathogenicity is nil in case of Hymenopus diminuta because usually there is a few or unnoticed infection. Diagnosis is by finding the eggs or sometimes gravid segments in the stool. Treatment, no need for treatment because the case is the case is incidental, and also it doesn't cause any pathology or symptoms for men. Prevention and control is by proper sanitation as well as getting rid of the main host, which is the rat or mice. The third type is Dipylidium caninum, or the dog tapeworm. The dog tapeworm is present in a cosmopolitan distribution. The definitive host is the dog, while the intermediate host is also the dog, flea, and the grain beetles, as the same as in case of Hymenolipes. This is the life cycle of Hymenolipis diminuta. We'll see here that dog is in the middle, but cat can share in the infection as well as man, who is an accidental host for the disease. Dipylidium has double genital pore on both sides, like we see. The gravid segment is large, about 3 to 5 millimeter, and it comes out in stools, and it carries egg sacs or egg packets, which are full of eggs, about 16 to 19 eggs at the same time. These eggs are engulfed by the larval stage of the flea, and when the adult grows, they grow inside the body cavity to form cysticercoid, which is the larval stage. When the fleas are swallowed, which is common in case of dogs and cats, because when the flea irritates their skin, they bite their skin in the place which is irritated. They always bite their fur or their skin because of fleas inside. This causes the flea to be swallowed, and the infection is repeated or occurs in case of dogs and cats, or when the dogs bite each other or the cats bite each other, they can get the infection by the infected flea. In case of human, it is an accidental infection, normally in children when they acquire the infection by ingesting the infected flea when they during their play with dogs or cats, and the infection, the cysticercoid settles in the intestine, the scolex comes out and gives rise to the strobila, which are all longer than broad, and the gravid segments come out within 2 months from the anus. Here is the scolex of Dipylidium caninum. The rostellum here has several rows of tiny hooks. This is characteristic for the scolex of Dipylidium caninum, and it has also 4 rounded suckers. This is an egg sac from a gravid segment containing several eggs. The eggs here, when we enlarge them or magnify them, we can see the hexacanth embryo here and double membranous embryophores. This is a mature segment of Dipylidium caninum, having here the ovary. This is the vitelline glands, and this is the genital pore. Here the same is on the other side, and the testes are scattered all over the segment. These dots are the testes scattered all over the segment. This is a gravid segment of Dipylidium caninum. When we see it in stool, it is like cucumber seeds، يعني عاملة بالظبط زي بذور الخيار، بذور الكوسة، الكلام ده، على أساس إنها بتبقى whitish in color and tapering from both ends, and the size is about 1 centimeter at maximum. This is an adult worm in its natural look. We'll see here, this is the scolex. These are immature segments. These are mature segments, while these detaching singly are the gravid segments. Each gravid segment contains egg sacs with many eggs scattered all over the segment. Pathogenicity. For human, there is a relevant pathogenicity of Dipylidium caninum, so we can call it non-pathogenic. In case of diagnosis, it is stool examination for gravid segments, and microscopy we can see egg capsules. Treatment, there is no need for treatment, or we can give niclosamide for once and we can get rid of the adult worm. Prevention and control is by deworming of the dogs and cats, as well as taking care when we play with dogs.